Hi, I'm Dr. Matt Alexander here with another weekly health update, and this week's topic is about sciatica. Now, the thing about sciatica is it's one of those terms that people use to describe really any abnormal sensation that they're having from their back all the way down to their feet. The truth of it is there are several different diagnoses that can cause pain, tingling, or numbness in the back and or legs. And so today I want to talk about some of those differences. So let me go ahead and have this spine here, and I'll show you some of the things that could cause these type of symptoms. So first of all, one of the most common is muscle spasm. So muscle spasm in the low back obviously can cause low back pain. If that muscle is pinching on a nerve, it could cause some radiating pain as well. One of the other common things that can happen is if somebody has too much curvature in their low back, the backs of these vertebrae, the little joints in there, they're called facets, can actually jam into each other. So that's called facet imbrication. And what happens with facet imbrication is it causes what's called a sclerotomal pain referral, which means there's a geographical area here in your body that can actually have pain. So you'll have a bigger area of pain rather than just in that focal spot where the joint is being jammed. Another common problem is actually if you have a sprain or a strain to one of these joints here in the back. These are called your sacroiliac joints or SI joints. They're very common areas to have low back pain. And they can also cause a little bit of a sclerotomal referral pain pattern. Now, as far as pain going down the leg goes, really it's going to be one of two things. It's either going to be a true sciatica or what's called a radiculopathy. So what a radiculopathy is when you're having one of these nerves here that come out to the side of your vertebra. One of those nerves gets pinched here at the vertebral level. And that can be pinched either due to degeneration of the disc in here, causing a smaller space for the nerve to come out, or actually a herniation or bulge of one of these cartilage discs that causes inflammation or pressure on one of these nerves. Now, so that's a radiculopathy. Now, a true sciatica is actually where there's a muscle here in the buttock region called the piriformis muscle. And you basically have this bundle of nerves that comes off and forms a very thick nerve. And that's the thickest peripheral nerve in your body. That nerve passes right underneath the piriformis muscle, and in a certain percentage of people, it'll actually pierce right through the piriformis muscle. Now, if that muscle gets spasmed there in the buttock for whatever reason, maybe sitting too long, maybe you've strained it in some way, or even a misaligned pelvis, that can cause irritation to that sciatic nerve. Now, a true sciatica will only give pain in the lower part of the leg, so from the knee down. So if you're actually getting pain higher up in the thigh region, in the low back, you really don't have a true sciatica. You most likely have one of those other conditions that we've talked about. Now, just to throw it out there, there are other things that can cause tingling, numbness in the legs, such as neuropathy that can be caused from diabetes and some other conditions as well. So that pretty much sums it up with the main things that can cause pain, tingling, numbness in the back and leg area. So hopefully that helps you, and you can get yourself to a doctor who can properly diagnose where that pain is coming from. That way they can treat the condition, because if it's not a true sciatica, you might end up actually treating the condition the wrong way and not be able to get the relief that you're looking for. So I hope that helps you out, and I hope you have a great day.